Is we're going to inject into the glabella area. Have you frowned real hard for me? Or what's frequently known as the 11s. And we're going to soften this area, relax that. How much is used depends a lot of times on the severity of the muscles. Usually most of the time it's about 15 to 25 units. Okay, and we're going to start right here. We're going to start right in the center. Okay, just relax it. And then 2 injections into these muscles on the side. Same thing on the left side. And then 2 slightly above it. And that's all we need right here. And then what I do is just massage this into the muscle. Usually what I have most people do is I have them to frown for usually about every 5 to 10 minutes over the next hour. That just helps the body to absorb it better. And then I use a little cytoactive. It's a hyaluronic acid gel. And what this does, this helps prevent the air from bruising after the procedure. There'll be a little bit of swelling in these areas, but that will usually go away in over the next 30 to 45 minutes. That will go away. And that's all we do to treat the 11s, or what's going to the glabella area. We're going to treat is what's called lateral canthus area, or what most people call it the crow's feet. Can you frown for me for a squint real hard for me? Squint. Okay, good. So what these lines right here, and one thing which the Botox would do, it helps to soften these areas. And the thing about it too is you want to kind of catch it before it gets bad, because a lot of times after it gets bad, it's harder to reverse the crease. And okay, I'm going to start here. First injection. And the last one here. Same situation, just like in other parts of the body, is, usually what I do is to have someone squint for, I'd say about 5 to 10 minutes the first hour after the procedure. It just helps the body to take the Botox up better. Same situation, there'll be a little bit of puffiness there, but that'll go away very quickly. Same situation, what I used to use a little hyaluronic, cytoactive, it's a little hyaluronic acid gel, and what that does, same thing, reduce the risk of anybody bruising. Okay, now we're going to treat the other side. Okay, same thing, we're treating the crow's feet, this area right here. Very common problem area. We're going to have you squint real hard for me. And when you squint, we're going to prevent these lines here from developing. You can relax it. And in this case, we're going to use about 15 units. The amount that's used varies a lot depending upon how severe, some of these lines are here. Yeah, the important thing I mentioned a lot of times, it takes about 4 to 7 days to take full effect for the Botox. The more you do it, the longer the faster it will work. So if somebody's been doing it pretty consistent for a few years, it's probably going to work within a couple days, whereas the first time somebody does it, it may take about a week for it to take full effect. I think it's usually it lasts about 3 to 4 months, and duration does tend to get longer the more you have had it done. The muscle just gets weaker, so it takes longer, so the effect lasts longer. And that's it.